Hi, and thank you for taking the time out of your busy schedule to chat and learn about the keto peptide formula from Functional Formularies, where our philosophy is let food be thy medicine. My name is Laura Doherty, and I'm the National Clinical Manager. My background is in ketogenic diet therapy, where I worked in the clinical field for 14 years. Keto Peptide is the first and only organic, whole foods, plant-based feeding tube formula designed for a medical ketogenic diet. Blenderized tube feedings have become increasingly popular in the past decade, and with our product, patients on a ketogenic diet can get both a formula that induces ketosis, but also offers the benefits of 12 unique whole foods. Each ingredient has been chosen thoughtfully to provide a unique function and nutritional benefit. Most ketogenic formulas available today are a combination of refined ingredients, simple sugars, albeit small amounts, and artificial additives. When we take a step back and truly look at formula labels, we must ask ourselves, is this really the best nutrition? When I was practicing, I was constantly battling reflux and constipation in almost every enterally fed patient. With reflux and constipation being very common side effects of a ketogenic diet, I think it's easy to just accept them. But further thinking took me down the path that maybe with better ingredients and a targeted GI approach, we could do better. Another way to think about the ingredient components of a keto formula is for oral ketogenic diet patients. We certainly aren't recommending cornstarch and sugar as carb sources, but likely promoting low-carb vegetables and fruits for carbs, so why settle for anything less in an enteral patient? That's what makes keto peptide so great. The ingredients are from whole foods. They are chosen for specific purposes. For example, the carb sources are beets, buckwheat groats, and almond butter. While these may seem like unusual carb sources, they serve important roles. For example, buckwheat groats are a natural emulsifier and are high in the amino acid methionine to help create a complete protein when paired with the hydrolyzed pea protein. Most keto formulas use industrial oils, including refined vegetable oil consisting of sunflower, soy, and palm oils. While these oils will certainly help someone achieve ketosis, they also contain an extremely large amount of polyunsaturated fats in the form of omega-6s. Keto peptide uses a combination of extra virgin olive oil and almond butter as monounsaturated fat sources, coconut MCT oil for its MCT content, and flax oil as a polyunsaturated fat source rich in omega-3s. Similar to how all saturated fats aren't created equal, polyunsaturated fats aren't created equal either, as they can be omega-6 sources, such as linoleic acid, and omega-3 sources, such as alpha-linolenic acid. Two very different fats, yet both polyunsaturated. Research has shown that when the omega-6 to omega-3 ratio gets out of balance, internal chaos can occur, as this imbalance is highly linked to inflammation and associated inflammatory processes that can be hiding under the surface. To create an ideal balance of these polyunsaturated fats, keto peptide has 3 times as many omega-3s as other keto formulas. In terms of protein, keto peptide contains multiple protein sources to form a complete plant-based protein. The primary protein source is hydrolyzed pea protein, a peptide for easy digestion and absorption. But secondary sources include almond butter and buckwheat groats to provide a well-rounded and complete source. Let's move on from the individual ingredients and talk big picture. Keto peptide is a 2.43 to 1 ratio with 5 grams of net carbs per pouch. Each pouch has 610 calories and 18 grams of complete protein, with 25% of total calories from MCT. It is free of gluten, dairy, soy, and corn. The only allergen from the top 8 list is tree nuts due to the almond butter and coconut. While keto peptide has some added vitamins and minerals, for ages 4 to 8, it is not sole source nutrition, and it will require some additional supplementation. Minimal fortification allows for the product to be used by all age groups. It allows the clinician to target exact micronutrients the patient needs without exceeding any nutrients that may not be necessary. In some situations, this may enhance tolerance of keto therapy. For oral patients, we do offer a keto recipe cookbook that contains several recipes using keto peptide as a base, including an avocado ginger smoothie, chocolate mint ice cream, and some simple smoothie blends as well. At Functional Formularies, we love the gut microbiome and all the benefits a healthy gut can do for the whole body, but especially the brain. Keto peptide has the largest amount of fiber at 10 grams per pouch and contains both insoluble and soluble options from a variety of real foods, including acacia fiber, coconut, lemon peel, almond butter, peas, and beets. The majority of the soluble fiber is considered a fermentable fiber or prebiotic to help feed the healthy bacteria in the gut. So pulling all these factors together, what have we seen with the utilization of our keto formula? The combination of fiber plus superior fat sources that contain more omega-3s than omega-6s to support an anti-inflammatory environment, as well as the removal of most allergens, results in improved GI health for most ketogenic diet patients. At the end of the day, should any of this surprise us, there are multiple studies evaluating the GI benefits of real whole foods. This article featured here was in Boston Children's Hospital by Dr. Haran and showed that blenderized diets are associated with decreased healthcare use, improved GI symptom scores, and increased patient satisfaction compared with conventional formularies. While the Boston Children's study was not done on a ketogenic diet specifically, why would these benefits not overlap into the keto world? It's certainly hard to believe that they wouldn't, but at this time, no randomized clinical studies have been done on blenderized whole food and ketogenic diet outcomes for enterally fed patients. But what we can tell you from case studies in our keto advisory team is that there is a universal desire to continue to use keto peptide, and most patients report improvement in GI function. We have case studies on all different keto ratios, administration types, including pumps, bolus, and gravity, as well as new starts and formula transitions. However, we fully recognize from both a clinician and caregiver standpoint that there are some extra steps that are needed when working with keto peptide. For example, it is a thicker product, so may take some tweaking for certain administration types. However, the viscosity of the formula may also be what lends itself to GI benefit. Clinicians have consistently reported that while there may be some extra upfront work, they tend to see less overall time in the long run. Less time on the phone working through constipation issues, less time on the phone dealing with reflux and vomiting. Clinicians have reported in their case studies that patients' quality of life and comfort level improved with improvements in GI tolerance. Patients were able to meet weight gain goals, support their seizure control, and achieve therapeutic ketosis using keto peptide. Our advice for transitioning a patient from another keto formula is to go slowly, because it may take some time for their bodies to adjust to the increased fiber and more complex ingredients. The 2.43-to-1 ketogenic ratio is in the middle of the ketogenic ratio scale. Being in the middle allows clinicians to individualize the care plan by adding ingredients such as avocado or oils to make the ratio higher, or adding ingredients in the form of carbohydrates, fruits, vegetables, or protein to lower the ratio. It's also important to consider how tailored you can get from a nutrient standpoint using whole foods. For example, if you have a patient that may need more carnitine in their diet, you can certainly add ground beef or lamb, both of which are high in carnitine. Or if you have a patient that doesn't tolerate calcium supplementation and would prefer a food-based source, you can lower the ratio with a low-carb yogurt or nut-based milk. Most ketogenic diet patients are great candidates for the product as long as they have a tube size at or above an 8 French. It can be given via NG tube, G tube, or J tube through a bolus syringe, gravity feed, or through a pump. Ideal candidates include families using a homemade keto blend that may want some relief. They just use keto peptide on busy days, for example, to help make life just a little easier. Or families who may be interested in a homemade blend but aren't ready to take the full jump. Keto peptide will allow them to wade into the whole food world. Patients with persistent GI issues, such as retching and vomiting, regardless of how many tweaks you have tried, may achieve benefit due to the increased viscosity. Patients with constipation or chronic reflux are also great candidates, as well as those with food allergies. And finally, those patients with lipid alterations, as the fat sources in keto peptide may help improve abnormal lipid levels given the higher amount of omega-3s and MCT. We've been listening to all the feedback the keto community has given us and have put together a more robust support team for you. We now have a keto-specific hotline from 8 a.m. to 5 p.m. Eastern Standard Time, where you can speak to a keto team member or communicate via email. We have the case studies that can be used as examples on transitioning patients to keto peptide from other keto formulas or those just starting their keto journeys. We also offer keto-specific webinars on our Continuing Education Center that will provide 1 continuing professional education credit. We have also revamped our website to have keto-specific section where you can find the case studies, clinical research, clinical modifications, insurance information, DME carriers, and more information on all things keto. This is also where you will find infusion tip information, including best ways to administer keto peptide through a pump. Some of our best advice for administering through a pump is to be sure you are not using any emulsified MCT with keto peptide during administration. It's totally fine to give the emulsified MCT by itself, but adding it to the formula will cause it to thicken. It's important to reblend the formula if you are adding any other ingredients. If you are adding water, it's best to use warm water. Cold water, or if the product itself is cold, will lead to thickening. Even if keto peptide is stored in an air-conditioned environment, it really would benefit from agitation and being run under warm water before use. Bolus extensions generally work better than a right angle, as that tight 90-degree turn can cause issues at times. And our last advice is to use the highest infusion rate tolerated by the patient. The higher the infusion rate on a pump, the more propulsion pushing the formula through the system. So in closing, I want to thank you so much for your time today. And this here is the link to our updated website with all of the keto resources that I just mentioned. Have a wonderful day.